1. Which of the following is a primary responsibility of a medical assistant during a patient examination? A. Diagnosing medical conditions. B. Assisting the physician and preparing instruments. C. Prescribing medications. D. Interpreting laboratory results. 2. The Health Insurance Portability and Accountability Act, HIPAA, primarily protects A. Physician reimbursement. B. Patient confidentiality. C. Staff training. D. Medical malpractice claims. 3. When taking a patient's pulse, which of the following arteries is most commonly used? A. Femoral. B. Radial. C. Brachial. D. Carotid. 4. What is the correct angle of insertion for an intramuscular injection? A. 15 degrees. B. 45 degrees. C. 90 degrees. D. 10 degrees. 5. Which laboratory test is commonly ordered to assess kidney function? A. Prothrombin time, PT. B. Blood urea nitrogen, BUN. C. Hematocrit, HCT. D. Alanine aminotransferase, ALT. 6. The medical assistant must place instruments into which solution immediately after use to prevent coagulation of blood? A. Sterilizing solution. B. Soap and water. C. Disinfectant. D. Chemical soak, enzymatic detergent. 7. Which of the following is an example of a subjective symptom? A. Elevated blood pressure. B. Fever of 101 degrees Fahrenheit. C. Patient reporting dizziness. D. Skin rash. 8. A patient reports feeling faint during venipuncture. The first action by the medical assistant should be A. Stop the procedure and assist the patient to lie down. B. Continue quickly to finish drawing blood. C. Leave the patient to find another staff member. D. Apply a tourniquet. 9. The proper sequence for the chain of infection is A. Reservoir, infectious agent, mode of transmission, susceptible host, portal of entry. B. Infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host. C. Portal of exit, susceptible host, infectious agent, reservoir, portal of entry. D. Mode of transmission, infectious agent, reservoir, portal of entry, susceptible host. 10. Which government agency regulates clinical laboratory testing under CLIA? A. OSHA. B. CMS. C. CDC. D. FDA. 11. Which of the following is considered a normal adult respiratory rate? A. 8 breaths per minute. B. 12 breaths per minute. C. 30 breaths per minute. D. 40 breaths per minute. 12. The correct action when a patient refuses medical treatment is to A. Reschedule the procedure without noting the refusal. B. Document the refusal in the patient's chart and notify the physician. C. Attempt the procedure against the patient's wishes. D. Ignore the patient's decision. 13. Which of the following ECG artifacts is caused by patient movement? A. Wandering baseline. B. Somatic tremor. C. AC interference. D. Interrupted baseline. 14. The correct procedure for cleaning a blood spill on a countertop includes using A. Soap and warm water only. B. A 1 to 10 bleach solution. Sterile saline. D. Alcohol swabs. 15. What is the primary purpose of the medical history? A. To provide legal evidence. B. To record patient demographics. C. To To provide information useful for diagnosis and treatment. D. To assess billing accuracy. 16. A properly performed hand-washing procedure requires A. 5 seconds with warm water only. B. 10 seconds with hand sanitizer only. C. 20 seconds with soap and water. D. 1 minute with cold water only. 17. The correct order of draw for venipuncture begins with A. Green top tube. B. Light blue top tube. C. Lavender top tube. D. Red top tube. 18. A medical assistant is instructed to obtain a throat swab. The swab should be collected from A. The uvula. B. The tonsillar area and posterior pharynx. C. The tongue. D. The nasal cavity. 19. Which of the following is a legal document used when a patient consents to a specific medical treatment after being informed of the risks? A. Living will. B. Informed consent. C. Durable power of attorney. D. Advance directive. 20. The main function of OSHA in healthcare settings is to A. Regulate insurance reimbursement. B. Protect patient confidentiality. C. Ensure workplace safety. D. Certify medical assistance. 21. When taking an oral temperature, the thermometer should be placed A. Against the hard palate. E. Under the tongue in the sublingual pocket. C. Between the teeth. D. At the back of the throat. 22. The correct needle gauge for most adult venipuncture procedures is A. 14 to 16 gauge. B. 18 to 20 gauge. C. 21 to 23 gauge. D. 25 to 27 gauge. 23. Which of the following is an essential component of effective communication with patients? A. Using medical jargon for accuracy. B. Maintaining eye contact and active listening. C. Interrupting to clarify points quickly. D. Speaking louder for emphasis. 24. In a SOAP note, the O refers to A. Objective findings. E. Observed patient behavior. C. Oral communication. D. Overall impression. 25. The correct disposal method for a used needle is to A. Place it in a regular trash can. B. Place it in a sharps container without recapping. C. Recap it before disposal. D. Place it in a biohazard bag. 26. A patient with hypotension has a blood pressure reading of A. 180/10 mmHg. B. 140 divided by 90 millimeters of mercury. C. 160 millimeters mg. D. 90/50 mmg. 27. A fasting blood glucose test requires the patient to avoid food and drink except water for at least A. 2 hours. B. 4 hours. C. 8 hours. D. 12 hours. 28. Which of the following is considered a violation of patient confidentiality? A. Discussing patient care with the physician in private. B. Sharing patient information with a coworker not involved in care. C. Giving medical records to a specialist with patient consent. D. Documenting treatment in the patient's chart. 29. The universal claim form used for insurance billing is known as draft. A. UB04. B. CMS 1500. C. EOB. D. CPT 99. 30. Which of the following vital signs is most critical to assess immediately in an emergency situation? A. Height. B. Pulse. C. Weight. D. Body mass index. 31. Which of the following is the proper position for a patient undergoing a rectal temperature measurement? A. Supine. B. Sims position. C. Prone. D. Fowler's position. 32. Which of the following tests is performed using a capillary puncture? A. Blood cultures. B. CBC with differential. C. Glucose monitoring. D. ESR, erythrocyte sedimentation rate. 33. Which document is used to detail the financial responsibilities of the patient before medical services are rendered? A. Advance directive. B. Assignment of benefits form. C. Financial policy agreement. D. Living will. 34. Which of the following is the correct site for an intradermal injection? A. Deltoid muscle. B. Gluteus maximus. C. Forearm. D. Vastus lateralis. 35. What is the purpose of calibration of medical equipment? A. To ensure the equipment meets OSHA guidelines. B. To ensure accurate and consistent results. C. To clean and disinfect equipment after use. D. To maintain confidentiality of records. 36. When coding a patient encounter for billing purposes, the diagnosis code is taken from which coding system? A. ICD-10-CM. B. CPT. C. HCPCS. D. DRG. 37. The correct PPE, personal protective equipment for handling body fluid spills, includes A. Gloves only. B. Gloves, gown, and mask. C. Gloves, gown, mask, and eye protection. D. Gown and shoe covers only. 38. A patient with tachycardia would present with which of the following? A. Rapid heart rate. B. Low blood pressure. C. Slowed breathing. D. Irregular temperature. 39. Which of the following best describes the sterile field? A. Any area within the patient exam room. B. An area free of all microorganisms. C. An area cleaned with alcohol swabs. D. The top of a disinfected countertop. 40. Which of the following is considered a hematology test? A. Lipid panel. B. Urinalysis. C. CBC, complete blood count. D. Liver function test.